Friends, we are here with the new topic and last topic of the renal system, that is the fluid and electrolyte imbalance. Right. So I hope you are ready to learn the fluid and electrolyte imbalance. Right. So let's see what are the objectives of the today's session. So at the end of the lecture, you must know regarding to the distribution of the body fluid. What are the different causes of the fluid and electrolyte imbalances? Pathophysiology, clinical features, clinical evaluation, and investigation, which are useful to diagnose the what are the different causes of the fluid and electrolyte imbalances. Right. So let's see. First thing. So remember, friends, fluid and electrolyte balance, that is a vital for the normal cellular or the organ failure function. ऑर्गन के फंक्शन और द सेल के लिए फ्लूइड और इलेक्ट्रोलाइट का बैलेंस बहुत जरूरी है. The body maintains the homeostasis through the tightly regulated mechanisms involving the kidneys, hormone and the cellular transport system, right? So imbalance होने की वजह से कब कब होता है? So volume of the fluid is there in the case of hypovolemia or in the case of hypervolemia. So fluid बढ़ जाएगा या कम हो जाएगा. And electrolytes like a sodium, potassium, calcium, magnesium, chloride and the bicarbonates, and the osmolarity like a hypoosmolarity or the hyperosmolarity. So let's see first the physiology, distribution of the body fluid. So remember one thing, at the percentage of the body weight and the volume, we take the volume about adult. So the total body water into the adult, the total body weight के 60% water है body के अंदर, और एवरेज सारा वाटर सब निकाल दी जाए तो 42 लीटर्स वाटर रहता है. सेल के अंदर का 40% है और वॉल्यूम है 28 लीटर्स इंट्रासेल्यूलर का, और एक्स्ट्रा सेल्यूलर को हम टोटल है 20% एंड द 14 लीटर, एंड एक्स्ट्रा सेल्यूलर में इंटरस्टिशियल 15% और प्लाज्मा में 5% एवरेज, and the volume interstitial 10.5 liter and the plasma for the 3.5 liter. So these are the distribution of the fluid which is present into our body. Right. Now let's see what are the different causes of the fluid imbalance. So first, hypovolemia, fluid loss, and second, hypervolemia, fluid overload. दो condition हो सकती है. So let's see first one. What are the causes of the hypovolemia, fluid loss? So first, that is the hemorrhage, vomiting, diarrhea, diuretics, burns, diabetes insipidus, and the third spacing like ascites or the pancreatitis. राइट. हेमरेज होगा, ब्लड निकल जाएगा, साथ में पानी निकल जाएगा, वॉमिटिंग में फ्लूइड सब बाहर आ जाएगा, डायूरेटिक्स एनी मेडिकेशन, यूरिन फ्रीक्वेंसी बढ़ जाएगा, बर्न्स में पानी जल जाएगा, डायबिटीज इंसिपिडस में पोलीयूरिया हो जाएगा, पानी निकल जाएगा, एंड द थर्ड स्पेसिंग या कोई स्पेस के अंदर वो बढ़ जाएगा, लाइक इन द केस ऑफ ascites or the pancreatitis or the pleural effusion, right? So all in these 6 cases there will be a fluid loss is happened, we can say that is the hypovolemia. Right. Now let's see what are the causes of the hypervolemia. So first, that is the renal failure. Because of the failure of the renal, urine is not properly happen, so the fluid overload is there. Congestive heart failure because of the low perfusion into the kidney, which can leads to the renal failure, and again the fluid overload is there. Cirrhosis of the liver, इट्रोजेनिक या एक्सेस आईवी फ्लूइड्स दे दिए हैं, और समटाइम्स एंटी डायूरेटिक हार्मोन इनएप्रोप्रिएट हो जाता है, सो सिंड्रोम ऑफ द इनएप्रोप्रिएट एंटीडायूरेटिक हार्मोन की ना होने की वजह से वो हाइपरवोलेमिया भी हो सकता है. So these are the 5 reasons which are causes of the hypervolemia. Now let's see what are the different causes of the electrolyte imbalances. So हम पहले पहले इलेक्ट्रोलाइट की बात करें. सोडियम सोडियम इज अन that is the Na plus. So sodium, that is the important electrolyte of the body. The normal value, that is the 135 to 140 MEQ per liter, right? So hyponatremia हो जाएगा किस केस में? वोमिटिंग में, डायरिया में, SIADH में और कंजेस्टिव हार्ट फेलियर में सोडियम कम हो जाएगा. और जब बॉडी में वाटर लॉस हो जाएगा, डायबिटीज इंसिपिडस होगा या ऑस्मोटिक डायूरेटिस होगा, सो हाइपरनेट्रेमिया हो जाएगा. बट रिमेंबर वन थिंग, द नॉर्मल वैल्यू दैट इज 135 टू 140 MEQ per liter. Second electrolyte, that is the potassium K plus. The normal value is a 3.5 to 5 MEQ per liter, and there is a risk when there is a hypokalemia, in the case of use of the diuretics, diarrhea, vomiting, and the excess insulin taking. So there will be a cause of the hypokalemia. And in the case of renal failure, nervous breakdown, and the acidosis, there will be a hyperkalemia. Once again, remember the normal value, that is the 3.5 to 5 MEQ per liter, right? Now let's see other causes of the electrolyte imbalances. Another electrolyte, that is the calcium. So in the calcium, Ca2 normal value, that is the 8.5 to 10.5 mg per dl. So what are the causes of the hypocalcemia? So hypoparathyroidism, parathyroid proper काम नहीं कर रहा है hormone, so calcium का metabolism नहीं होगा. Vitamin D is also a contributor to metabolism of the calcium. So in the case of vitamin D deficiency, again hypocalcemia we can find. Pancreatitis and the causes of the hypercalcemia. So once again, hyperparathyroidism or some malignancy can causes the hypercalcemia. Once again, remember the normal value, that is the 8.5 to 10.5 mg per dl. Another one, that is the magnesium. So normal value magnesium, that is the 1.6 to 2.6 mg per dl. And the causes of the hypomagnesemia, they are due to the alcoholism, malnutrition, and the diarrhea. And the causes of the hypermagnesemia, that are the renal failure or some magnesium therapy, like we are using to the eclampsia, right? Now the chloride and the bicarbonate, both are there. So the normal value of the chloride, that is the 98 to 107, 107 MEQ per liter. And the normal value of the bicarbonate, that is the 22 to 28, right? So they are associated with the acidosis balance disorders, and it is a loss via GI tract or the kidneys. So I hope you can easily understand what are the different causes of the electrolyte imbalances, right? Sodium, potassium, calcium, magnesium, chloride, and the bicarbonate, right? Now let's see what is the pathophysiology. So pathophysiology of the imbalances of the electrolyte, right? So let's see first sodium. So how the sodium imbalances occur? So sodium का main function है control the extracellular fluid volume. So when the extracellular fluid volume imbalances occurs, so osmotic shift is there, and due to that cellular swelling, and the cell will be shrinkage. Brain is the most sensitive part, and when the sodium is a low, so there is a risk of the seizure and the coma, right? Second, that is the potassium imbalance. So potassium regulate the membrane potential, right? So उसका cardiac and the neuromuscular effect है. So when it is imbalance, arrhythmia आ रखकर, murmur आ रखकर, weakness is there and the paralysis is there, right? Now let's see other pathophysiology of the other electrolyte. For calcium, so calcium is important for the muscles contraction and the nerve conduction or the coagulation. So when it is imbalance, there will be a tetany, right? So जब कैल्शियम कम हो जाएगा so टिटेनी होगा, और जब कैल्शियम हाई हो जाएगा तो कॉन्स्टिपेशन, कंफ्यूजन और द स्टोन होगा. Same magnesium is important for the modulated the neuromuscular activity and the enzyme function. When it is imbalance, it affects the heart and the central nervous system, right? So I hope you can easily understand what are the pathophysiology or what are the normal function of the electrolytes, right? Now let's see what are the clinical features when the electrolytes are the imbalance. So when there will be a condition hypovolemia, so symptoms are the thirst, dry mucosa, hypotension, tachycardia, and the oliguria. When there is hypervolemia, there will be a edema, weight gain, dyspnea, jugular venous distension is there. Now, when if that is the hyponatremia, सोडियम कम हो जाएगा, so nausea होगा, headache होगा, confusion होगा, seizures होगा. जब सोडियम बढ़ जाएगा, person goes into the lethargy, वीकनेस हो जाएगा, इरिटेबिलिटी हो जाएगी और पेशेंट कोमा में चला जाएगा. सोडियम पोटेशियम कम हो जाएगा, हाइपोकैलेमिया होगा, मसल्स आर वीक, cramps, arrhythmia are there. If potassium is a hyper, so there will be a risk to develop the paresthesia, paralysis, cardiac arrest, right? There is a risk of a hypocalcemia, so there is a tetany. चेओस्टेक साइन क्या होता है हाइपोकैल्सियमिया में? पेशेंट को आप लेफ्ट साइड आप टैप करोगे, वो लेफ्ट साइड या लेफ्ट साइड मुंह उसका टर्न होगा, like that is the chaotic sign. And the Trausu sign, so your fingers and your hands like become like that, cramping hoga, so that is the Trausu sign, right? When there is a hyperglycemia, there is a risk of the stone, bones and the groans, psychiatric condition ho jayegi. And when there is a hypomagnesia, neuromuscular irritability hogi, tremors hoga, right? And in case of hypermagnesemia, there will be a hyporeflexia, reflexes नहीं आएंगे, lethargy होगा और the respiratory complaints हमें दिखने को मिलेगी. So these are the clinical features we have to found in the different water imbalances as well as the electrolyte imbalances, right? Now let's see what are the clinical evaluation, and first we have to take the history taking part. So we have to ask regarding the fluid intake and the output first. How much fluid you have to intake and how much fluid you have to urinate it. There is a there is a complaint of the vomiting or the diarrhea is there, and any use of the medication or the diuretics, renal history, cardiac history, and the liver history we have to check, right? And after the history taking, we are move on the physical examination. So first we have to measure the vital sign for the blood pressure and the pulse, signs of dehydration, dry mucosa, skin, turgor sign we have to check, sunken eyes, that all are suggest the dehydration. And if there is a overload, there will be a edema is there, ascites is there, in the respiratory sound, crackling sound you can hear, and there is a rise of the jugular venous pressure is there. When you do the neurological examination, you found the altered sensorium or the seizure, right? And the last one, that are the cardiovascular signs. So you can find the arrhythmia, or when you do the ECG, in ECG there is a potassium, so it is easily find into the ECG also, right? So these are the clinical evaluation, common physical examination regarding to the water imbalances and the electrolyte imbalances, right? Now let's see investigations. Which investigations are we have to perform to rule out what may be a cause of the uh, water imbalances and the electrolyte imbalances, right? So basic laboratory investigation कराएंगे blood का. So serum electrolyte कराएंगे sodium, potassium chloride and the bicarbonate. So from that serum electrolyte से हमें electrolyte imbalances पता चल जाएगा. We have to do the serum osmolality and for the evaluate the osmotic balance, and we have to do the urine electrolytes also. So determine the renal handling of the electrolytes कि renal electrolyte में renal में से कितने damage हो रहा है. Serum urea and the creatinine for the assess the renal function. We have to perform the serum calcium and the serum magnesium. They are the specific mineral imbalances we have to got. We have to perform the arterial blood gas analysis because of the HCO3, evaluate the acid base status. And the last one, that is the ECG, for the detect the arrhythmia into the potassium, calcium and the magnesium imbalances, right? Some additional tests are also required for the clinical suspicion. So we have to do the hormonal assess, aldosterone, renin and the ADH for the SIADH measurement. We have to do the endocrinal test like a parathyroid hormone and the vitamin D investigation. Some imaging chest imaging investigation are also useful for the fluid overload chest X-ray and the renal USG for the ascites. So these are the different additional tests we have to perform to what may be happen when there is a electrolyte imbalances are there, right? Now let's see summary regarding to the electrolyte. So remember, when there is a diarrhea, sodium is a low, potassium is a low, calcium is a normal, volume status, fluid volume is a loss, and there is a history of the GI loss. When there is a renal failure, always सोडियम नॉर्मल रहेगा, पोटेशियम बढ़ जाएगा, कैल्शियम बढ़ेगा या घट होगा, वॉल्यूम फ्लूइड ओवरलोड होगा, यूरेमिक साइंस हमें दिखाई देगा. SiADH होगा, सोडियम कम हो जाएगा, पोटेशियम में कुछ नहीं होगा, कैल्शियम में कुछ नहीं होगा, वॉल्यूम इधर नॉर्मल और इंक्रीज. क्लिनिक क्लूज हमें मिलेगा यूवोलेमिया और द इंक्रीज एडीएच. हाइपरपैराथायरॉयडिज्म, सोडियम में कोई टेंशन नहीं, पोटेशियम कैल्शियम बढ़ जाएगा, वॉल्यूम स्टेटस नॉर्मल रहेगा. बोन पेन देयर इज द रिस्क ऑफ द किडनी स्टोन्स हिस्ट्री मिलेगा. एंड द यूज ऑफ द डायूरेटिक यूज, सोडियम घट जाएगा, पोटेशियम भी घट जाएगा, कैल्शियम नॉर्मल रहेगा, वॉल्यूम स्टेटस कम हो जाएगा. एंड देयर इज अ you have to found there are the drug history. So these are the summary you have to found. Now, my friends, what are the key points to the remember after this session? So, electrolyte are the interdependent, and we have to treat the underlying cause. Electrolytes should be stabilized. We have to give the rapid collection, especially for the sodium, because imbalances of the sodium can be dangerous. And always assess the volume status first before the correcting the electrolytes. पहले हमें ब्लड का वॉल्यूम, वाटर का वॉल्यूम देखना है, उसके बाद इलेक्ट्रोलाइट को हम करेक्ट करेंगे. So with the proper treatment and with the proper line of the management, we can easily identify the cause, right? And we can easily manage the case. But remember, we have to take the step into the rapidly, because when the electrolytes are the imbalance, जैसे कि पोटेशियम बढ़ जाएगा, हार्ट को प्रॉब्लम होगा, सोडियम बढ़ जाएगा, कम हो जाएगा, ब्रेन को प्रॉब्लम होगा. So we have to take step regarding that. First, treat the underlying cause, find the underlying cause, treat the underlying cause, and if there is a hypo, so we have to fulfill the electrolytes outsidely. So for in the sodium and water and electrolyte imbalances, there is a no specific treatment we have to found into the homeopathy. But we have to give, there is a hypo, we have to give the additional uh, sodium or the potassium from the outside of the body like IV parenteral fluid, and we can manage the case, right? So my friend, you are easily understand your today's objective, and what are the consequences happens when the electrolytes are the imbalances, what are the pathophysiology behind it. So I hope you can easily understand and remember the today's session. So here we completed the symptomatology of the renal system. So once again, thank you very much. Stay tuned, and if you have any found a query or a question, comment, or the contact me as soon as possible. I will be try my best to solve your query. Thank you very much.